so soalan kita akan selalu untuk lihat yang pasukan kita sampaikan dalam jadi kan pasukan pasukan yang nasional yang pasukan secara jadi harus tinggal para sit for now awal ini mau kita kayak macam itu saja yang ada tapi
ini pun macam tadi juga tu saya kurang minat lah sebab dia khusus fakta khusus kan.
so kita yang tujuan
Okay.
Kok nak scan tak yang tu? Yang program hari ni? Kok ni yang Dr. Azniza tu. Kok ni. Saya pun.
Okay, Bismillahirrahmanirrahim. Alhamdulillah Rabbil Alamin. Wassalat wassalamu ala ashrafil anbiya'i wal mursalin. Wa ala alihi wa sahbihi ajma'in. Alhamdulillah. So today we will try to relax and try to not to put our stress more, and then we will try to discuss about the stress management and how you can maintain your self-care. Okay, I'm Professor Dr. Noor Azniza Ishak from School of Applied Psychology. So today we will try to discuss how you can, how you can you can proceed to, to get to know to the stress that can give you a very positive outcome, or the stress that can make you feel very moody, or maybe you will get some depressed, tension and all that. Okay, so first of all, I just want to know whether all of you maybe once in your lifetime try to get to know the status of your stress level. Do you try to get yourself to know, or use some instrumentation just to get to know what is your stress level? Okay, so if not, maybe today you can help yourself to get to know the level of your stress, a very brief, and maybe you can get along with me and try to get to know what is the level of stress that you are reaching now. Okay. Okay. So for now, okay. Okay, wait. Okay, so sometimes you can see yourself keep on thinking and thinking, but doing nothing and all that. Or maybe you get boring and you just want to sleep and want to get involved in whatever activity that you are in now. It is very good for you to know what is your stress level. And for now, let's us kind of doing some instrumentation that involve perceived stress scale that can help you to know the current situation and how this instrumentation can help you to know the stress level of yourself. Okay. Okay. First of all, this perceived stress scale is a classic stress assessment instrument actually. Okay, and these tools will help us to understand how different situations affect our feeling and our perceived stress. Okay, so you will get to know the different situation that can affect you. I mean your feeling and of course your stress level. Okay, and then the question in this scale will ask about your feeling and thoughts during the last month, which means that you will have to sort of a flashback whatever situation that you are in. So you will try to get to know and try to give the point to whatever situation that can affect your feeling. Okay, and then the question in this scale will ask about your feeling and thoughts during the last month, and in each case you will be asked to indicate, okay, to indicate how often you felt or thought in a certain way, which means that if you answer the question exactly represent how you feel, and then how you react for this previous month, so it will help you to know what is actually the level of stress you are in now. Okay, and then although some of the questions are similar, there are differences between the terms and you should treat each one as a separate question. Okay, so although there will be some question that can that will guide you to focus directly or firmly that is the situation you are in, then and that is the skill that you want to give. I mean the point that you want to answer for that question. So just answer the question, and then the best approach is to answer quickly. Okay, when I give the question, you please don't take too long to answer. Just very quickly put the number or put the weightage to the answer. I mean to the question, and that is, don't try to count up the number of times you felt in a particular way, and rather indicate the alternative that seem like a reasonable estimation. So just estimate. Okay, please don't calculate, but just estimate. Okay, don't put the burden into your mind and try to get it very accurate and all that. No. Okay, just put it the estimation of it and try to get to know it. Just maybe to put it mungkin you want to give the question by the weightage 1 until 4. Okay, so what you can do is, for now, please prepare yourself with a pen and a piece of paper that you can write. Okay, and then we will go through together. Okay, and then the second one, okay, and then the second one, okay, okay, after this I will show you the question, and then you will start to put the number 1 to 10, so you can write the answer directly to the question, and then take a moment and read through each of these statement, and for each one choose from the following scale. If you want to put it 0, okay, it will it will tell you that you never come into that situation. Okay, if you give it 1, almost never, but maybe come across, but as you can memorize it, okay, maybe you can put it 1 for almost never. So that situation almost never happened to you. Okay, if you put it 2, weightage 2, maybe sometimes. Okay, and then if you put it 3, fairly often. Okay, and then if you put it 4, very often. Okay, so are you ready now? Okay, so we have here all the candidates and all that. So are you ready to give the time for you to diagnose yourself whether you are in the stress, a very high stress level for this previous year, month? Okay, so come. Okay, let's do it. Okay, I hope you are ready for now with your pen and your piece of paper. Okay. Okay, thank you, Siva. I can see your hand. Okay. Okay, please read each statement. Okay. Okay. For number 1, okay. In the last month, how often have you been upset because of something that happened unexpectedly? So very quickly, just put 0, 1, 2, 3, or 4. Okay. 0, 1, 2, 3, or 4. Okay. Okay. Finish. Don't make yourself starting counting and thinking and all that. Just estimate it. Okay. The second one. In the last month, how often have you felt that you were unable to control the important things in your life? Okay, come. Okay. How often have you felt that you were unable to control the important things in your life? So please give the grade. Please give the number. Okay, number 3. Okay, this is not the exam. Just you want to know yourself. Please ask yourself. Okay, in the last month, how often have you felt nervous and stressed? In the last month, how often have you felt nervous and stressed? Please ask yourself. Okay, and number 4, in the last month, how often have you felt confident about your ability to handle your personal problems? So please ask yourself again. You felt very confident about your ability to handle your personal problems. Okay, you say it's kacang saja. Okay, okay. Number 5, in the last month, how often have you felt that things were going your way? Okay, things were going your way. Okay, you feel very happy, very minimum stress, you say. Okay, and you get very confident yourself. Okay, how often? Okay, in the last month, how often have you found that you could not cope with all the things that you had to do? Okay, how often have you found that you could not cope with all the things that you had to do? So you feel miserable and all that. Okay, in the last month, number 7, in the last month, how often have you been able to control irritations in your life. Okay, you can control irritation, something coming up, not the one that you like. Okay, so how often have you been able to control it? Okay, and then number 8, in the last month, how often have you felt that you were on top of things? You can see that everything is under control. Okay, and number 9, in the last month, how often have you been angered because of things that happened that were outside of your control? Okay, so try to ask yourself, just estimate. Okay, how often have you been angered? Yeah, because of things that happen that were outside of your control. You cannot control it. It happens and you don't like it. Okay, and number 10, in the last month, how often have you felt difficulties were piling up so high that you could not overcome them? So you feel very difficult, and then you cannot overcome, and you just let it be, let it go. Okay, so this is the things that you can you can put the number. Okay, 0 is never, 1 almost never, 2 sometimes, 3 fairly often, and number 4 very often. Okay, I hope you can finish up. That's only 10 questions. Just get to know, just want to get to know what is the level of our stress in previous month, which means that in this 1 month setting. Okay, so are you ready to know the result of yourself? Okay, just if you don't want to say something, just give me your sign. Okay, just so I know that you were there. Okay, just give me some signs and all that. Okay, okay, thank you, Tariq. Okay, so we want to go to the PSS score. Okay, but first, before you calculate everything, just go to the question number 4, number 5, number 7, and number 8. Okay, number 4, number 5, number 7, and number 8. Jadi, so on this first 4 question, please change the score. If let's say you put it 0, please give 4 marks to it. If you give you put it 1, please give 3. If you put it 2, you have 2. Please give 2 marks for it. If you put it 3, please give 1 marks for it. And if you give it 4, please put it 0. Okay. So for number 4, 5, 7, and 8, reverse it. Okay. So you calculate backward. Okay, you calculate backward. And now for now, add up your score for each item and get the total. My total score is, okay. You can give yourself some times and please calculate it. So actually, individual score on PSS, we can range it from 0 to 40. Okay, because we have 10. Because we have 10 questions. So so the maximum point is 4. So it is about 40. Okay. So out of 40, please calculate what you get. Okay. No need to show me. Just put it, just leave it to yourself. Okay. So if you do it well, so you know better. You know your stress level better. Okay. If you your score range from 0 to 13, 0 to 13, you would be considered low stress for the previous for this month. For the previous month, which means that you are very low stress. Okay. if your scores range is about 14 to 26, would be considered moderate stress. Okay, so you are in the moderate stress. And if your score range from 27 to 40, would be considered high perceived stress, which means that for the past month, you are in the very you are in a very high stress, and we can say that maybe you need to talk to somebody, maybe you need to somebody support and all that. Okay, and then maybe we can discuss here how you can manage your stress. Okay, so actually the PSS is interesting and important because your perception is what is happening in your life is most important. Sometimes we don't know ourselves, and then when things that we going to which mean that we are not in the mood to do things and all that, maybe we can check ourselves. Maybe we are in a very high stress or de-stress, we call it. Okay, and then we can see that we consider that if you get the score, the low stress or moderate stress or high perceived stress, it is about yourself for the past month. Which means that you know yourself for now. If you are in the low stress, so maybe you can check your work and all that, or some things that that you want to meet the KPIs and all that. So you must try to level up your stress, because the stress can help you to finish up your work. Okay, but we must manage and control our stress in order not to make the stress higher, and it can go to the distress level, or the high perceived stress, or because this can make you what do you call it, make you feel don't want to continue your work, or maybe you just will leave everything, and you start to feel the burnout and so on. So we afraid that you cannot keep on the very good I mean the very good and something that you can achieve, that consider that you want to achieve in your life. Okay, so with that, we will try to know the things that, or the I mean we will try to go what is stress all about. Okay, stress is actually everything is inside your body. Okay, that is why stress is your body ways of responding to any kind of pressure or demand. So if you get stressed, try not to blame others. Okay, try to check to yourself, and try to get to know yourself better. If you're always in the high stress level or de-stress, maybe you cannot control yourself and you cannot manage yourself, and then you are in a very high expectation people, or person. So in that case, everything you want to do it perfectly, so that's why you cannot manage yourself, and then you will get a very high level of stress. And then is stress bad? Although we always say, oh, I don't like stress, I don't want stress and all that. Actually, not all stress are bad. It depends on the situation and how it is handled. Okay, so you cannot live. I mean, you cannot achieve something if there is no stress in yourself. But you must live with the stress. But we must manage it and control it in order to make ourselves uh, um, make ourselves in this we can stabilize ourselves, so that we can always get to know ourselves and can manage it towards, I mean, toward things that that when you are in a very crucial situation or what. Okay, so actually good versus bad stress. uh, when it's come to good stress, we call it eustress. Okay, eustress. Eustress actually is a very good stress. Okay, when every morning you come to work and all that, you must stay with the eustress. If not, you are not motivate to some things that you want to finish up your work and all that. So you must call up the eustress to come to you, and then you must adjust yourself, control yourself, and try to try to level up the stress, and then try to finish up your work. Okay, so normally the eustress will come up uh, uh, maybe at 7 o'clock in the morning. So you will try to get yourself ready to do the work and all that. Okay, that's why eustress is a good stress. It is stress that arises from the demand of pleasant or fun activities. Okay, it is a bit stress, but you must try to adjust and try to, maybe you want to get something that you very, I mean, you like to do things and all that, so you are in the eustress. But when it comes to the distress, actually we can call it a bad stress, because it is the stress that we experience in regard to negative demands. So you try to push yourself, even though it is not your level, even though maybe it is more than things that you can do. Okay, so it demands to which that we must adapt, which means that if you change department or what, or if you change the mode of study or what, so it will affect everything. I mean, the routine of work, the routine of life and all that. So it will consider that things that you have to start again, and or you have to learn more, or you have to get more information and all that. So it can occur the distress or the bad stress, because you must have more time to adjust with that situation, especially the new situation. Okay, especially the new situation, or things that it is not in line with your expectation. Okay, sometimes we are very serious about our expectation and all that. So the punctuality, the things that we want to get in order and all that, it must schedule up according to the procedure and all that. So that things that sometimes when things that spontaneously we have to change it and all that, so it will give you the distress because of the changing of the situation and the event and all that. Okay, so it is when we experience stress for too much of the time. Okay, and sometimes you want to do everything, and everything you must be perfect, so it will cause you distress, and it is not good for you. Okay, okay, and then when we come up to cause of negative distress or negative stress or distress sometimes is considered our environment, noise, air pollution also sometimes can give you distress, or social overcrowding of population, okay, and then or interpersonal behavior of others. Maybe it is not according that the one that we like or we expect and all that. So maybe the difference of others that we cannot expect and all that. So that's why it will consider or it will get you to the distress situation, okay, or sometimes our personal life. That's why from the beginning, I keep on telling you, it is about your personal sometimes. Overthinking thoughts and then put the thoughts, I mean, to consider everything as if you are the only one. I mean, you are the only human in the world and all that. So that also will cause you negative stress. And then furthermore, your feelings. Sometimes we like to ponder to our feeling, to get close to our feeling, and only we are the one that everybody must consider concern to, okay. So if not, you will get the mental distortion, saying that nobody likes you, nobody wants you, nobody want to give you the promotion and all that. So everything is about your personal, okay, everything is about your personal. And then of course your emotion, our emotion, that sometimes it can give you everything that's very I mean, everything that you like, okay. But sometimes your emotion also can give you some things that very stressful, okay. So because you keep on playing with your emotion, playing with your emotion, saying that you only consider your emotion, and everybody must consider you, and must take up maybe must always focus to you and all that. So it will give you, I mean, sometimes it will cause the distress, because you are not getting it, because it is not beyond your control, it is others. Sometimes we expect, oh, she will like you, he will likes you, eh? But we must know that that is yourself. You perceive it, or that is your perception. It is not others. We cannot control them. So if things happen to yourself, in yourself, so you will responsible for it. So you are the one that create distress, not others. But well, our defense mechanism always say that, oh, that's others, that is because of them, that is because of their their family, or their maybe their apa, the apa, the situation, and then the environment. I mean, maybe the luck also, we can say that, okay. So this is things that we perceive, okay. This is thing that our perception take charge, okay. So that is only perception, it is not reality. So that's why personal take charge, that cause distress. So overthinking things that sometimes you know that it is not in our in your control, but you always think about that, you want it more and so on. So that's why, okay. So things that within your perception is not yet reality, so please put it in the reality, so it will lower the stress situation, distress situation, okay. And then the physical, about the illness, about the injury and all that, so it can cause you distress. And then about the important things, and then sometimes stresses can be obvious or hidden, okay. Things that can push you to get whether you can control it or not, also we call it stressor, okay. Stressor can be obvious, so you can see it, but sometimes you cannot see it, Because always psychologists will focus it to the things that whether it is in conscious mind or it is in unconscious mind. Things that in conscious mind, so you know it happened. Okay, it happened I mean you know it happened, but things that are in unconscious mind, but it happens, but you don't know why it is happened and all that. So sometimes stressor will give you the sign that you are in a very critical stress and all that. And stress also can give you a very can lead you to a mental health problem. So you better manage it because it starts from stress. Okay, it starts from stress. When we say about stress, it is not in here. Okay, it is not here. It is here. So you generate it. Okay, you generate it. We call it the side of our brain. We call it amygdala that always control the emotion. So when the situation comes and you don't like it, so sometimes you put it here. So you build with it. So you try to put it there and you do not flight it away. So that's why you keep on thinking about it and for a long time. That's why it can cause you distress. Okay, so it starts here, and then when it comes here, that you can feel it, that you can feel it. Actually, it is the product of what happened in amygdala. Okay, so if you don't want you to get more distress, you must fly away the things that or the situation that it's not give you a good sign to carry on with your life. Okay, that is why it is happen. Okay, and then respond to high level of stress, we can say increase cortisol levels. Okay, sometimes the high level of stress, it can increase cortisol. Cortisol is one of the hormones that can help us to make ourselves active and energetic and maybe young. Okay, we can feel young. Okay, but if we always in the stress mode, so the cortisol is cannot level up with DHEA, one of the hormones that can helps you uh, to 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 make yourself physically and mentally, or maybe you can present yourself as a very very active person that can always happy. Okay, okay, but because if you increase up your cortisol as early as 7 o'clock in the morning, so the cortisol only can slow down maybe at night. I mean 11 or 12 at night. So that's why please don't call the cortisol more than you need in a day. Okay, because if you always calling this cortisol hormone, so the other hormone that can build up, I mean you look like younger and all that, so it will I mean it will come slowly, or maybe it will focus on the cortisol. That's why that day you will get angry. Okay, or you are in the very high stress level. Okay, so if you increase the cortisol level, it will interfere with learning and memory. Okay, because you are not in a very good mood, you are very moody that day because your stress level is very high because of this cortisol, okay, hormone. And then it will lower immune function. Okay, you will easily get sick and all that. And then increase weight gain because you always want to eat and all that, because you don't want to, but you try to make yourself divert from all things that you have to think about and all that. And then higher blood pressure, and then higher cholesterol, and heart disease, and or stroke and all that. That's why please don't call this hormone cortisol very high in your daily work life, because you see it can give you the effect physically, emotionally, and all that. Okay, so who are the one that can call cortisol? You are the one. Okay, how you can do it? By always thinking, and maybe you put things that not in order and all that, so you are not ready for that situation and all that, so you will try to push yourself and all that, so you are the one that call the cortisol hormone easily in your life, I mean in your daily matters. Okay. Okay, and then we can say to coping with stress. Sometimes we try to punish ourselves. Okay, using these negative methods. Okay, that's why we will try to eat more, or sometimes we are smoking drugs, or using drugs, overeating, using caffeine and all that. Okay, so please try to adjust yourself. Try although you are in the stress mode, please try to use the positive coping methods by exercise, meditation, yoga, positive attitudes, time management, taking breaks and all that. So don't punish yourself, love yourself. Okay, so because you are the one that put yourself in the stress mode. Okay, so that's why today we will try to manage it. Okay, and then so what is it, it is about is it is all about self-care. Okay, so for today we know that we are in the what level of stress, because we try to to know the level of stress apa, for ourselves. Okay, so in that case, if we know that we are in the distress mode. Okay, so how we can do the self-care, how we can proceed with our self-care. So actually the self-care, the practice to taking action to preserve or improve one own health, which means that we know we are in the stress mode, so don't burden ourselves, don't put it more distress to ourselves. Okay, try to take a break. Try to tell yourself, please take a break. Love yourself. Okay, don't punish yourself because of somebody else, or because of you are not reaching the things or the level that you want and all that. So please don't punish yourself. Try to understand yourself. Okay, and it is a routine or a lifestyle. Okay, so please try to put the self-care as a routine and your lifestyle, which means that please, because of others you want to punish yourself. It's not right to yourself. Okay, and then a good self-care, firstly, you must have your regular sleep. Okay, sometimes we say that we want to relax ourselves, but actually we are not in a very good or quality sleep, because we try to break up ourselves into everything, into thinking of everything that we want to do tomorrow, or we want to start up things, whatever activity that we want to do tomorrow, and so on. So we sometimes we are doing things that we are not give a very good self-care to ourselves. Okay, because we always want to satisfy others, but not ourselves. Okay, and then the second one. Okay, and then the second one. That's why uh, the regular sleep you must. I mean the quality sleep you must have every day. At least you have 6 to 7, 6 to 7 hour of sleep, and then it will takes you about nearly 5 hours of uh, uh, you have a very deep sleep, and that is the very quality sleep. I mean, for the age like I mean adults, okay, adults, okay. And then second one, try to exercise, okay. Sometimes you try to exercise yourself, but the exercise that you try to proceed yourself, exercise that you want to make yourself diet and or skinny more than I mean you try to reduce your weight and all that. So it is not actually do the self-care, but you try to form others burden to yourself in order to get something more. Okay, so try to exercise in order to relax. Okay, to relax and try to focus to the the activity. Okay, and then relaxation. Relaxation we can do it using our mind or using our physical things that you can do the activity and then you focus to the things that you are doing, which means that there's a procedure to tell ourselves that you are in this position and please focus to that position. So that is relaxation. And eating well. So this is things that although you are in the stress mode, please don't punish yourself for I mean to gain the weight of yourself and try to punish yourself by doing things that it will cause you maybe you can get sick or what. So please look into your diet. Okay, so to focus more to yourself and then try to relax and then to stabilize your mood. Okay, and then okay, okay, too stress to distress. Okay, sometimes if we prioritizing our self-care, okay, we try to prioritizing our self-care, you can set a goal. That is the very minimum way that you can help yourself by setting a goal. Okay, setting a goal, you can see that you have target to go, so you know yourself, you know your effort, you know whether you can do it or not. So set a goal. Okay, don't say yes to everything and anything and everything. Okay, please ask yourself first, you can do it or not. Okay, okay, and then try to make a plan. Okay, plan yourself. Okay, and then write it down. It is very useful to you. Write it down, because things that in your head it is not necessary I mean like that things that you want you write down in reality. Okay, so plan and try to write it down. Okay, and then try to get support. If you know that you are in what level of stress, get support. Okay, talk to somebody, and then maybe you can ask for help, and then try to do things that you have your me time. Okay, you have maybe you yourself you have your me time. Okay, So maybe you like to cook, or maybe you like to see something. Maybe you like to something adventurous and all that. So try to get to know yourself, and then get support to whatever happened to you. Okay, and then reward action, not result, which mean that you can reward yourself. And then something, although that is the result that you want or you don't want, and so on, but you try to appreciate whatever that you are doing. Okay, try to appreciate yourself. Okay, not to say that, oh, I'm very useless, I'm very I'm not good in this area, I cannot pass things that everybody they have the A grades and all that. So actually try to reward according to the action that you are doing. So please help yourself to know yourself, and then and then to appreciate whatever you are doing, and then turn bad days into good data. Okay, not every day, not every bad days is bad for you. Okay, actually things that you are not getting to it, or things that not in your expectation and all that, actually it is good for you to help yourself to build up more to build up more resilient, I mean to be more resilient, things that you can build up in yourself. Okay, so failing in whatever happened to you, it is not the last day of the world. Okay, so you always can coming out, and then you always can perform more and more, and then you can take that as your experience and all that, and then you can push yourself to get what you deserve. Okay, so this is things that you can do when you distress. Okay, and then sometimes we go to the progressive muscle relaxation. Okay, there's short progressive muscle relaxation and extended progressive muscle relaxation. The things that you can do it. Maybe you can follow the music and all that. Okay, and then why progressive muscle relaxation? It is about being completely aware of what happening in the past, of all that's going on inside and all that happening around you, which means that you can lower your cortisol level. So relaxation, something that sometimes we cross by to the situation, and we will tell ourselves that that is okay not to be okay. Okay, it is okay to not to be okay. So sometimes we punish ourselves. Okay, sometimes we punish ourselves. We put it a must. Actually, in counseling, when we helps the client, so we always focus to the irrational thinking of the client. Sometimes when the you level up your cortisol level and you get stressed and all that, you always say that I must get what I want, I must get it, they must love me, they must concern about me, they must. So you put the must. Okay, must, which means that everything is a must. But actually in our life, so everything actually it is not confirmed. It is not things that you must get it, you must it must happen. No, we cannot say that to ourselves. It is because actually we only can expect. Okay, we can expect it, but whether we will get it or not get it, sometimes we must pray to the God to give us and all that. Okay, that's why we cannot say that, oh, I must get it. So because I've been working that for a long time. Okay, especially for, let's say, for the promotion and all that. Yeah, sometimes you say that it's been 3 years, 4 years, I've been sending my form and all that. So maybe you must put it some effort more, and then to get to know what happened, within that process and all that. So for us, to help ourselves, sometimes we try not to put it in irrational way, or irrational thinking, saying that things that you must get it and all that. Okay, and then can help to return your body back to normal. So this is about muscle relaxation. Okay, then sometimes if you like to follow the instruction of the exercise and all that, you can browse the website, and then you can follow the instruction. Okay, and then review of stress. Sometimes we can say that the stress is the body respond to a perception of danger, which means that things that it is maybe exceed the level, that the things that you can cope. Okay, and then the cortisol stress hormone cause increase the heart rate, breathing at a fast rate, and give you a burst of energy. That's why sometimes they will try to isolate, or give yourself, or maybe just stay in the room and all that, don't want to come to work, don't want to come to the class and all that. Okay, that's why maybe they will crying, and then sleeping and all that. So we know that maybe they are in a very high level of stress, or we can call it distress. Okay, and then we can say that if you are very you want to get to know the key body system react. Actually, when we are stressed, the nervous system consider, okay, physically or psychologically. So we cannot say that it only concern our psychological of our body. No, it will cause physically or psychologically. We are sweating. We sometimes we cannot remember the things that we have to remember. Okay, so the nervous system will affect. Okay, and then the body suddenly shift in energy resource to fight of the perceived threat, and it in what is known the fight or flight. That is things that will come to the amygdala, so the nervous system, and then sympathetic nervous system signal, and then adrenal glands to release adrenaline and cortisol, and then this hormone make the heart beat faster. Okay, that's why when you are very in the distress mode, so you can see that nervous system, yeah, your heart beat faster, and then it will raise blood pressure and change the digestive process and burst glucose level in the bloodstream. Once the crisis pass, body system usually return to normal. But let's say that every day you are in the distress level, so it will cause something, it can affect your body, especially the nervous system. Okay, and then about the musculoskeletal system. You're under stress, muscle tense up, contraction of the muscle extend period can trigger tension, headache, migraines, and previous musculoskeletal condition. Okay, jadi kita punya muscle lah. Okay, so our muscle system, and then respiratory system. Okay, sistem pernafasan juga. So it will also cause the stress. So stress can make your breath harder and cause rapid breathing. Okay, kadang-kadang sesak nafas. Okay, so you cannot breathe properly. Okay, and then cardiovascular system. Okay, if acute stress, acute stress that can momentary, such as being stuck in the traffic. Okay, so be careful. Don't give yourself a very high degree of stress every day. It will cause your physically and psychological effect. Okay. Okay, and then after that we can see that endocrine system, adrenal glands can brain send signal from the hypothalamus, causing the adrenal cortex to produce cortisol, and the adrenal modulator to produce epinephrine, and then sometimes called the stress hormone. This is what I told you just now. That is considered whether you can fight or flight. Okay, so you are the one will control whether you want to stay with that situation you are not happy, or you want to flight away. Just put it away, move on. Okay, so this is the one. And then intestinal system, and then reproductive system. Okay, that is things that can affect to your body. And then after that, if stress, we can say that it is the fact of life for most people. You may not be able to get rid of it, no, in your life, as you can say that you are a human, so you will stay with the stress, so we only can manage it. Okay, and then we can say that the quickest solution involve your sense. Everyone is unique, and so you need to find what works for you, and then you may need a combination of techniques to be most effective, and keep trying. Okay, so you will stay with stress, or only you can make it high or make it low. Okay, so you are the one that be responsible in your stress management. So please use your sense to relieve stress. Okay, sometimes you can feel it. Okay, sometimes you can smell it, sometimes you can touch it, sometimes you can taste it, and so on. So that is the things that you must know yourself. Okay, you must know yourself, and stop blaming others. If you are in the stress level, you are the one to be responsible. Okay, and then after that we can see that, okay, if you are in the stress mode, exercise. How we can do it? Benefit are strongest with routine exercise. Okay, try to lower your stress hormone, improve mood, and act a neutral pain, a natural painkiller. Jadi which means that no need to take the painkiller, but try to try to exercise to lower your stress hormone, and then improve your quality of sleep. Okay, quality of sleep, which helps to reduce stress and anxiety. Psychologists always says that things that you want you will get more quality sleep is you try to adjust 1 hour before you sleep. You try to read, you try to put things that very happy in your mind. Okay, so that's why if you want to sleep, don't open up your TikTok and all that to see things that you don't like and so on. Okay, so we always like that before sleep. We always read things that actually can burden our mind and um make us a very moody about that and all that. So try to adjust yourself 1 hour before you sleep. Try to get things that you love, and then try to think about things about what happened, that whatever situation that you want to get involved and you like it and all that, or recite Al-Quran and all that. That is a very good things for you to adjust, or to make yourself happy after when you wake up in the morning. Okay, and then engage last muscle group with repetition movement can be particularly stress relieving. which means that large muscle group of which means that do something to your muscle lah. Okay, so make it works. Okay, and then find some things you like doing, walking, dancing, climbing, yoga, and so on. Just do it. Okay, but please move yourself. Okay, movement therapy and all that. So try to get yourself moving. Okay, and then prioritize exercise in your routine because of the overall health benefit associated with the movement, which means that every day try to push yourself, try to take things or what, doing things or what. So try to move around, okay, not to just sit there. Okay, that is one thing. If you want to control your stress level. And the second one, consider supplements, which mean that common one are lemon balm, omega-3 fatty acid, and blah 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 lah. You know yourself better. Okay, but be careful. Things that can give you uh, anonymous cell or something that you can prescribe things that maybe will give you canceration or what. Okay, so try to consider the supplement uh, that uh, um, that are safe for you to consume. Okay, and then the third one, aromatherapy. Okay, sometimes we just do the candlelight and so on just to make our dining or living room to see whether it is good or not. But sometimes the aromatherapy, maybe we can put into the place that we always will stay there. Okay, so things that you like. Okay, common said that that we are very that can open up that can give us catharsis and all that. Okay, and then furthermore, reduce your caffeine intake. Sometimes if you are stressed, you maybe you take a very long time in coffee house, and sometimes you always apa, take more caffeine. Okay, actually caffeine is found in coffee, tea, chocolate, every day, and other energy drinks, pop, and some non-prescription medical like cough syrup and sleeping tablets. And then high dose can cause anxiety actually, because it can cause heartbeat very high. Okay, so people have difficult threshold of if you notice you are jittery or anxious, you need to cut back. And studies show coffee can be good, but it is not for everyone. 5 or fewer cups of coffee a day is considered moderate intakes. Okay, so lagi kalau if we are stressed, we keep on taking coffee and all that, so be careful. Okay, and then furthermore, write it down. Okay, if you are stressed, write it down. Okay, because when you write it down, you try to pour everything into the paper. Okay, on the paper. Okay, on the paper. So when you write down the stress you are what stress you are, better yet, write down what you are grateful for in life, and then try to give yourself some time. Yeah, try to appreciate it, not just punish yourself. Okay, if you say that bad things about yourself, say good things also about yourself. Okay, what performance that have you done, and until today and all that. So please give gratitude to some, because some gratitude may relieve stress. And furthermore, if you can talk to somebody and all that, and share things that you write, that you are writing and all that, so it can makes you feel that I'm useful, I'm worthy. Okay, so that's why you must help yourself to focus to the positive changes of mindset to the more positive frame of mind. Okay, so we can see it now, because if you are in a distress mode, so you always see things bad about yourself. Okay, so if we write something good about yourself, so it will it will reserve some space to you, that you are still useful to yourself and others. So please write it down. It is not the same as you just think it, or you just do the perception about that. Please write it down, because when you write it down, it is a sense of confirmation, things that you are good in. Okay, and then furthermore, chewing gum. One of study found greater sense of well-being, lower stress with chewing gum. Chewing gum. I don't know. Maybe some people like to chew gum. But maybe please ask yourself. Okay, please ask yourself. It is because of the sweetness, or of the things that we will do it, because when we do the activity, actually we will channel or divert our thinking. Okay, so we are not concentrate the things that make us angry, moody, and so on. So when we chew the gum, so it will help us to think divert, or think we will think things that not focus to the things that we are not like it. Okay, and the recent study on stress relief also found the greatest relief with chewing more strongly. Okay, maybe you can try it. Okay, and then experts are uncertain of the reason, need more research, but a possible explanation is that chewing gum cause brain waves similar to relaxed people, and or may promote blood flow to the brain. Okay, so you do something else actually. Okay, when you do something else, so it will lead you to do to not to think it so much about things that you are not like. Okay, maybe you can try. Okay, and then number 7, spend times with family and friends. Okay, so you can feel the love and belonging. Okay, when you have the belonging part, so you know that you are useful to others. There are people that needs you, that needs you. Okay, so provide a sense of belonging which help in tough times. Okay, so that's why we must gathered. Okay, gathered, and we must know what level of stress of our sibling, or our friends, our good friends, or our parents, and all that. So we must know the level, what level of stress they are in, so maybe we can give some helps to them. Okay, one study found that women in particular spending time with family and children helps release oxytocin, a neutral stress reliever. Okay, so which means that maybe pets and all that also we can consider things that can divert. Okay, things that can divert your thinking. Okay, that will decrease your stress. Okay, and then both men and women benefit from friendship. Okay, so that's why when we are stressed, maybe we think about our partners, our spouse, our boyfriend, our girlfriend, and so on. Sometimes we will try to so maybe we will smile personally, or what. Okay, and another study found men and women with a fewer social connection were more likely to suffer from depression and anxiety, so they are lonely. Okay, so they are lonely, so try to find social connection, but the positive social connection. Okay, okay, and then a laugh. Sometimes you can say that, oh, why laughing? Actually, laughing helps by relieving your stress response. Okay, or relieving tension and relaxing muscle. Actually, when you laugh, it will coordinate with every single muscle in our face. So you will look even younger. Okay, so please stay, smile and laugh. Okay, but not to laugh to yourself only. So your friends will think something else. Okay, it is hard to feel anxious when you are laughing. Okay, it is hard to feel anxious when you are laughing, and then long-term laughter improve immune system and mood. So try to take it easy. Okay, not to put yourself the burden and then try to punish yourself. Okay, and then study a laughter intervention group found individuals with cancer experience more stress relief with laughter intervention than with simple distraction. Okay, so they put off the cancer cell, so they can interact to each other. Okay, okay, and then learn to say no, please. If you do want stress, please say no. Know yourself. It's okay to say no. Okay. Sometimes we try to satisfy everybody, and we don't want to say no. That's why say no more often can take control of the parts of your life you can change and are causing your stress. Okay, and then especially Malaysian. Okay, sometimes they don't like to say no, and then they will get stressed and de-stress and depression and all the way. Okay, this is especially important when you find yourself taking on more than you can handle. Always like that. Okay, sebab kesian pada orang. Okay, not to yourself. Being selective about what you can take on, saying no to things that will unnecessarily add to your load and reduce stress level. So please say no. It's okay to say no. Okay, know yourself. And then number 10, learn to avoid procrastination. Okay, procrastination is things that sometimes make you suffer because you have to do it to the last minute, and then sometimes you will get it or sometimes it will not match to your expectation. Okay, so stay on top of your priorities and stop procrastinating. Okay, sometimes they say, oh, it's okay. But the times, I mean, the deadline and is another is 1 month to go. So it's okay. So after that, you cannot meet to the deadline. So you will get stressed. And then procrast leads to reactive behavior, which leave you scrambling to catch up. Okay, it's very miserable actually. Okay, this can cause stress which negatively impacts health and sleep quality. Okay, especially towards the end. Okay, and normally students like to do it. Okay, they say it is very adventurous. Sometimes the computer will blow up and they cannot get the grades that actually they can get better if they are not procrastinating. Okay, make a to-do list organized by priority. It is very good actually to control your cortisol hormone. Okay, please organize by priority. Okay, and then make realistic deadlines and work down your list. Okay, realistic deadline. When and how you can do it properly, and then work on things that need to get done today. Okay, and then give yourself interrupted times, because multitasking and switching between tasks can be stressful. Okay, give yourself uninterrupted time, because you see, if you keep on procrast the things that you have to do it more in a very limited time. Okay, so you will get more stress. Okay, and then take a yoga class if you like it. Okay, if you like it. Okay, and then practice mindfulness. So mindfulness anchors you to the moment. It helps combat the anxiety in inducing effect of negative thinking. And there are several methods of mindfulness. If you like to do this activity, so you can browse the website. So it has mindfulness based cognitive therapy, based stress reduction, yoga, and meditation. Okay, and then a recent study on mindfulness found that it may increase self-esteem, which lessen anxiety, and depression symptom. Okay, so what is the activity of mindfulness actually? The activity we can consider one of the activity. So when we try to jumble up everything in our mind, okay, so we say to ourselves, stop, and then we take a few deep breath, okay, and then we breathing, and then we try to take a few deep breath, and then we observe what more that we have to do, okay, and then after that only we proceed. Okay, so this video maybe can help you to get to know the stop techniques and for mindfulness. Okay.
Prof, we can't hear the video.
Things that you
Okay. I can see that Siva told me that you cannot hear the sound, but it's all right. Maybe maybe our Salleh Graduate School can give this slide to you or what. Okay, so you can refer it again. Okay, I'm sorry about that technical problem. Okay, okay, so okay. And then 13, maybe cuddles or kissing, hugging, and sex can help relieve anxiety. So this is things that sometimes it can give you a relaxing situation or feeling and all that. Of positive physical contact release oxytocin, which lower cortisol levels and lower blood pressure and heart rate. So things that you can be love and belonging supports and all that. Okay, and then furthermore, listen to soothing music. So this is also the things that maybe a slow upper pace instrumental music can induce the relaxation response by helping lower blood pressure, heart rate, and stress hormone. Okay, so sometimes of classical Celtics, indigenous, and East Indians music can soothing also, or simply pick a type you join, you enjoy, and nature sound may also help calm individuals. Okay, it depends to you, which means that how you can divert your thinking to the something else that make you better. Okay, but please don't divert yourself to things that punish yourself. Okay, try to do things that very good to you. That is a self-care. Okay, and then after that we can say that deep breathing. Okay, deep breathing also can helps you. Sometimes we are in a very rushing situation, stress, very stressful and all that. We uh, we even forgot to take a deep breath. So please sit down and calm down and try to take a very deep breath and give uh, give away to yourself. That why mental stress activates your sympathetic nervous system, which cause a fight or flight response, which means that you can decide whether you want to put yourself in that struggle situation, stress situation, or you want to fight and flight away. Okay, so just give sometimes to your body and to yourself, and try to take a deep breath. Okay, and then deep breathing also activates your parasympathetic nervous system, which control your relaxation response. And there are several types of breathing exercise. Okay, so breathing exercise, or sometimes if you go to the hospital and get some helps from the psychiatrists or some counselors or what, so they always do this breathing exercise, which mean that it consider the diaphragmatic, abdominal, and belly breathing along with the pace respiration. Okay, which mean that you take you take a very deep breath, and you try to lower your breathing, and then try to help yourself to give some oxygen to your body. Okay, and the goal is to focus on your breath by making it slower and deeper. Okay, so you also will focus to yourself. Okay, and then when you breathe deeply through your nose, your lung fully expand. Okay, so you close your mouth and then try to breathe deeply through your nose, and your belly rise, causing your heart rate to slow, which provide a feeling of peace. Okay, so you can do it yourself. Okay, try to get to take a very deep breath, and after that, spend the time with your pet. We can see now everybody, they have their pets and all that. So maybe give sometimes to your pets and all that, holding them. Okay, and then try to speak to them, and maybe to hug them and all that. Okay, and then after that we can say that pets decrease stress. Okay, spending the time with your pet also release oxytocin, which improve your mood. Having a pet gives you purpose, keep you active, provides companionship, all of which help to reduce anxiety symptom. Okay, and then get enough sleep. Make a good sleep environment that with little noise and so on. Limit alcohol and caffeine. Take a warm shower of bath. Avoid blue light exposure before bedtime because it interferes with circadian rhythm, which means that the blue light. Okay, so practice good sleep hygiene. Journal, write down, which means that you can write down thoughts and worries, and then you don't have as much anxiety at bedtime, which means that when you write down, yes, write down, which means you can pour all the things that you have been thinking before that to the books or to the paper. Okay, that's why sometimes you are suggested to do the writing. And then schedule worry time. Okay, cognitive behaviors help you to think through and address your concern before bed, which means that you try to schedule up things that you are worried, or deadline and so on. Just put there. Okay, I will take care of it tomorrow. Okay, so you put it there. So don't ever think it over and over and over again. Okay, and then after that, time management. Say no to more unnecessary tasks. Prioritize, map it out so you can coordinate your time, write down everything. Then do tasks online if possible, because we have alternative now. Okay, we have alternative now. Instead of having to go out, then stay organized. Okay, and then know your limitation, and then review your schedule weekly and adjust the prioritize accordingly. Plan ahead so you are not scrambling to complete tasks. Okay, this is time management. Maybe it's very easy to say, and it's very hard to do it. Okay, and then okay, my two sides of time management. Okay, the more prepared you can be, the less stressful future you are in. Okay, if you are fighting every morning to get out of bed, try to buy yourself a alarm clock, and then make yourself responsible for the behavior. Okay, I don't know whether you have so many alarm clock or what, and yet you are not getting out of bed every day on time. Okay, or if mornings are rush for times, get clothes and lunch ready the previous evening. Okay, recruit help, a spouse or children. Children can pick up their own clothes and so on. So you train everybody. If you have 5 children, or if you study and yet you are working and yet you are doing something part-time work and all that, you know yourself. So please schedule, and then try to put things accordingly, and then try to get ready everything, the clothes, and then the bags and all that. So you put it accordingly, and train our spouse or our children and all that to do it that way. And after you get ready, and then you go to sleep, and then when, let's say that you wake up late or what, so you manage to get everything in order. Okay, because once you get yourself to sleep, maybe you cannot control anymore. Okay, maybe you cannot you cannot say that, I will, I will, and so on. I will get up early and so on. We cannot just predict that things will happen and all that. So it is about all. So that is things that we discuss about stress management and so on. I hope that you can get something, maybe just one line or what. Maybe you can do something to yourself, or maybe you know what level your stress are for now. So try to get out of distress, and it's okay to get yourself used stress, because stress will always be with you every day. Okay, So it is, I mean, you will decide whether you want to make it more and push yourself to de-stress, or just level up yourself to only use stress to get the work done. Okay, I think it is about all. Thank you for listening, and then thank you for give me the opportunity to talk to you. Although I can see that I'm maybe I just talking by myself. It's okay. I just predict. Okay, I just predict that you are all there and you get something from it. Okay. Okay, so maybe we can see each other sometimes. And then thank you also, our Sabi Graduate School, for asking me to come and to talk to you. And then I hope that everybody can manage yourself. And then it's okay to be stressed, but not distressed. Okay? Okay. Assalamualaikum warahmatullahi wabarakatuh. And a very good morning, still morning, 11:30. Okay. Okay, so I think it is all. It is about all. Okay, whoever that like to maybe chat or ask me something and all that, just don't hesitate to give me a call, or maybe you can WhatsApp me, or you can email to me, using Insta, or things that that you can manage contact me. Okay. Okay. Anything to ask? Is there any question? So there's no question there. Okay. So there's no question. So all the best to you.
Ada soalan sikit, Prof. Boleh?
Oh, ada soalan ni? Okay. InsyaAllah kita try.
Okay, saya tarik daripada keselamatan.
Oh, okay.
Uh,
Yeah.
Actually, Prof, I'm highly agreed with Prof regarding the effect of stress, which can lower immune system. My personal experience, high blood pressure and migraine regularly. My question is, Prof,
Yeah.
what is the best solution to overcome interpersonal stress in the workplace, especially when you have numerous of subordinate? Thank you, Prof.
Okay. So thank you, Mr. Tariq from Keselamatan. Okay. Actually, interpersonal stress, it is everything to do with how we communicate. Okay, how we communicate. So when we communicate, we put ourselves into ourselves. So how we communicate, our style, our expectation, and our everything is things to do that how we concern about that. And then the party, I mean the one that we communicate, they have their own value, their own style of communication, and all that. That is because the stress will occur when the two parties cannot differentiate what they are discussing about. Okay, so they cannot have the mutual understanding, things that they have to tone down, or maybe they have to listen, so maybe they have to agree with each other. So that's why it will occur the stress. So what you can do, Mr. Tariq, actually, when you talk to somebody, especially the interpersonal communication and all that, so you know yourself. Okay, you know yourself, and then you know the other party. You know the other party. So that is the first one, and then the second one, try to level up your expectation. because actually you are in the stress mode because your expectation cannot match. Okay, you cannot match. Okay, there are two things that you must consider. Okay, when you speak to others, okay, you will ask your emotion part and then your intellectual part. Okay, and then sometimes which one that you focus. Sometimes when you want to say things according to your value, your knowledge and all that, and then you put your emotion in that particular situation. So you will try to convince the other party to follow you, which is not true, or which is not good for you. Because you see, if you are not level up your expectation, so the argument is there. So you will argue until you win. Okay, but when you argue until you win, or the other party win, so you will affect your emotion. Okay, you will affect your emotion. That's why before you want to interact with anybody, you must level up your expectation. This is my view, this is my knowledge, this is what I want to say. If you agree, okay, proceed. If you are not agree, it's okay. This is only my view. So you have to reserve in order to control yourself not to be distressed. You are getting distressed, you are in the distress mode because your expectations are very high. So once you say, everybody must follow. One, you give the view, everybody must appreciate that. But no, you cannot control everybody. You only can control yourself. So in that case, level up you. So please say to yourself, this is my view, this is my opinion. So it is up to you whether you want to agree to it, whether you don't want to agree to it, you don't want to agree to it. It depends. It's up to you. Okay, so we will freely and free ourselves and freely give a freedom to them whether want to agree to it or not. Okay, that so you can level up, so you can cool off, and then you can, yelah, boleh tidur lah sebenarnya, kan? Kita yang tak boleh tidur sebab mesti ikut saya. Okay, so kita stress hasil daripada tidak ada orang yang nak dengar kita punya pandangan, kan? Jadi bila orang tak mau dengar pandangan kita, dok marah, kan? Padahal ikut dia lah, itu pandangan kita, kan? Kemudian arahan pula. So sometimes we must give orders. The orders is everything to do with the procedure, with things that maybe SOP and all that. So if you want to work here, so please follow the procedure. So sometimes we can deal with budi bicara and all that. It depends to the special situation and all that. It may maybe consider the sometimes the very crucial situation or what, so you can consider about that. But mostly you have to follow the instruction because you are the one that want to work here, because you are the one that signed the form, agree to work here, so you must follow whatever the direction, or maybe you want to give the order and so on. So you have to follow, because we are not asking you to come here and to work here, or to come here and to study here. Okay, you are the one that agree to it. You are the one that choose to yourself. You are the one that decide. Okay, so things like that you have to differentiate. We say we can say in psychology, we always ask the client and help the client to differentiate. So this is my role, this is my time, and then this is myself and also and all that. So it is very different from others. We only can control ourselves. We cannot control others. We cannot control others. We only can give our view. We only can speak the orders, but we cannot we cannot control them to follow us. Okay, boleh ke tarik? Kalau nak sembang lagi nanti kita sembang. Kita sembang lah anytime, boleh contact saya je. So is there any more question? Is there any more
Prof.
question?
Hi, Prof. Can you hear me?
Yeah. Oh,
Siva
Siva,
here.
yeah.
Yes,
Yeah,
thank you
Mr.
very much.
Siva.
Very, very interesting. I liked what you were saying. And I totally agree with a lot of the things that you're saying. One of the things I definitely will pick up is reward actions and not results, because I think I have always been doing reward results, not my actions. And I think that is a very, very useful point for me, because as you said, it's what you do, and if you can do it, then you reward yourself, because action is not
Yes.
in our hands as such, as isn't it? You don't know what's going to happen as such.
Yes.
Yeah,
Yeah.
but I think one of the things from me personally, from my experience, what I just wanted to share is that we ourselves don't really know that we're actually so stressed until someone else tells us. I think that is a problem that I always end up with, because I always do it, and I'm in a so
Yeah.
stress level. I mean, when I did the test just now, I'm at the higher level. So people will tell me, "Oh, you're too
Yeah.
stressed." And I think that's
Yeah.
the thing. Are you able to identify yourself whether
Yeah.
you are actually in that stress level? And
Yeah.
that is the most difficult thing, I think, for anyone to be able to identify is the most difficult. Maybe if you can maybe give us some guidance on how do we
Yeah.
identify that we are already at that stress level. I know you have said those things, but it's also, you also say, oh, we're already there, and then you say, de-stress here, do these things, but then you say, you're in so much stress, but then you say, I don't have time to do exercise, I just don't have time to sleep. you know that is the
Yeah.
thing. So it is
Yeah.
trying to identify, oh, you're already in that stage. How are you
Yeah.
going to identify that you're in that stage and it's time to take
Yeah.
action? Things probably that'll be helpful. Thank you.
Yeah, thank you, Mr. Siva. I think I can understand you because you see, mostly, I mean, most of us are like that because sometimes we build up our routine to do works and all that. I mean, to do things and all that, and then we are not really focused to ourselves. That's why we put it self-care. Okay, so please focus to ourselves. Okay, sometimes we do things and all that for others, to satisfy others, but what is it for us? Okay, so in that case, I know, I can understand why Mr. Siva say like that, because towards the experience that Mr. Siva share with us just now, so, we can see that maybe the focus is to the social, to the social or to the situation itself or surrounding itself, not to yourself. Okay, until someone say to you that, Siva, are you in the distress mode, and then after that only you try to try to look into yourself. Okay, so sometimes it is normal because your focus and routine is always like that. Maybe you want to finish up your work, to finish up the work perfectly, and then you try to I mean, maybe you are a very workaholic person, and then when you do things, you want to do it perfectly and so on. So that is the thing. But after this session, but you must try to look into yourself. Okay, there's no answer for you are not there's no time for you to look into yourself. There's no time for you to sleep in very quality manners. No, you cannot say that because you must allocate times that can help yourself to improve. Okay, because you see, if somebody in a very stress mode or distress, I can say that distress, if you carry on doing like that every day, okay, every day, and then you are not concerned about yourself, you are not concerned about yourself, so you just let it be. Whether you are in a distress mode or what, you just let it be. You are not turning to somebody to help you, to the support system and all that. You just let it be. So if you keep on repeating the same thing, I mean the distress mode every day, there's a possibility you will focus or you will go into the anxiety level. Because for now, okay, for now, as you know, the mental health situation, or we can say that we can involve in the mental health problem. It is not because of the you inherit ke or keturunan ke apa benda. No, it is because your lifestyle, mostly because of your lifestyle. Okay, because you are not considering yourself above all. Okay, so if let's say you keep on distress and then repeating the distress mode every day, and then you are very potential to go to the anxiety level. And after that, the anxiety level also, they have the mild, moderate, and acute. If you come up to the acute anxiety, you can consider to come to the depression. And after that, you can come to schizophrenia and furthermore. So you decide yourself. Okay, so that's why if you can say that if you feel very maybe you can very confused, or you are not in the mode of eating, you are not your appetite is maybe you are not you do not have the appetite. Okay, you are not happy with others and all that. So please try to sit down, do the the mindfulness and all that. Stop a while and try to look into yourself. What happened to me? What happened to me? Sometimes when we do the medical checkup and all that, so the sugar level is going up, and then the cholesterol and furthermore everything is going up. So that is also the sign that your stress is going up. And then sometimes it is not the stress level anymore. You are going to the mental health problem, because you cannot sit down and look into yourself and then try to consider into yourself to get things balanced into your life. Okay, so for all, if you love yourself and try to focus yourself, because you want to use yourself until your pension and so on, and then until your until yelah maybe 20 years, 30 years more and so on, and then until we are old and all that. But if you are not ready to help yourself, to get to know yourself and to control your stress level, it can consider it can cause you a very harmful a lifestyle that can cause you you are in the mental health problem. Okay, so Mr. Siva, what I can say to you, just give yourself sometimes the instrument that I give you just now, that is one of the method that you can always ask yourself. Okay, and then furthermore, maybe you can go to your loved one and then try to ask them. How I mean, what is your reaction, or what is your opinion, or what is your view towards me? Am I on the track, or am I not on the track, or what? So please ask somebody and talk to somebody, and always allocate some me time for everybody. Okay, which means that upon everything that a very hard time for you, a very crucial time for you, and all that, always do the self-care. Okay.
Yes, Prof. Thank you.
Okay.
Yeah,
If
very
if
helpful.
if you need more more explanation and all that, don't hesitate to call me, or you can email to me and all that.
Yes, very
I'll
cool.
I'll
Thank you.
yeah, I'll be happy to help you.
Yeah, I like the one where you said focus yourself, which basically probably I need to probably, because you did
Yeah.
mention right what you are, what have you been, and probably I
Yeah.
need to do that, and then maybe I need to think, what would I advise if someone else is in my situation, what would I advise that person, and then try and do that to myself.
Yes.
Probably that's
That's
what
right.
you're saying, focus yourself, isn't it?
Yes. Yes. That's very true. Okay.
Yeah, that's what I need to do.
Sometimes we are very stingy to ourselves, in order to give time to us. Okay. So try to focus to yourself. Inshallah, you will get better.
Thank you. Thank you, Prof.
Okay. Okay. Is there any more question? Okay. Okay, already, yeah. So, maybe okay. With that, I thank you. So, maybe we can see each other again. Uh, so, uh, so that's all, I think. Okay. Assalamualaikum warahmatullahi wabarakatuh, and a very good morning. Still morning, yeah? 11:56. 4 minutes to go. Okay. Okay. Bye bye. Okay. Miza, ada sesi bergambar ke? Saya nampak macam ada sesi bergambar. Yeah. Oh, okay. Yep. So, okay. So, saya serahkan kepada urus setia. Silakan. Ada sesi bergambar.
Okay. Please turn on your camera, please. We want to take a picture.
Okay. Sila buka gambar-gambar yang cantik dan lawa. So, you kena kata cantik dan lawa pada you setiap hari. Setiap hari tengok cermin, senyum. So you will appreciate yourself. Okay?
We will wait until few seconds before we take a picture.
Okay.
I'm ready to take. Okay. Okay. We will take. Smile, smile.
Okay. Smile. I can see that you are not stressed anymore. I hope. Okay.
Okay, we're done. Thank you to all, and we will share the QR code for attending for you to scan. Okay. Thank you.
Okay. Bye-bye.
Bye-bye.
Assalamualaikum. Bye-bye. See you all again.
Thank you, Prof.
All the best.
Thank you, Prof. Yes. Wait, just hold on for a while. Just hold on for a while. Just hold on, hold on for a while. Miss Maggie, did you receive the email? Sir, I sent ready exam board. நான் வீட்டுக்கு போறேன். வீட்ல இது. I cannot do. Okay, அந்த ஸ்டூடெண்ட் வந்து நேத்து மிஸ் கோயிங் சொன்னாங்களா கரெக்ஷன் 6 பேர் இல்ல 7 பேர். அது ஒண்ணு வந்து நான் ஹைலைட் பண்ண மறந்துட்டேன். விஜயா சம்திங் தி கேர்ள் நேம். So I missed out one.